You're listening to the 123 show with me, Noreen Mayer, on this Wednesday afternoon. Since it's Wednesday, we'd like to focus on wellness and medicine. So let's turn to our very first topic and guest of today. In the next 20 minutes or so, we're talking about fallopian tubes and reproductive health with Dr. Ellen Lui, who is a specialist in obstetrics and gynecology and also an honorary clinical assistant professor at the University of Hong Kong. Welcome to the program, Dr. Lui. Thank you so much for joining us.
Welcome.
So this afternoon, we're talking about fallopian tubes.
Yes.
I'm sure many of our listeners have heard of these little tubes inside the female body, but I'm not sure if so many of us know the role of them. So can you start off by telling us the role of fallopian tubes?
Okay, so fallopian tube actually acts as a bridge between the ovaries and also between the womb. So it is where the eggs and also the sperm will meet and where the egg will get fertilized and where the embryos will form. And so it is one of the very essential parts if we're talking about fertility and having a baby.
So I've heard that fallopian tubes health is really important when it comes to reproduction because it's essential. It's the vessel which carries the egg, as you mentioned. Can you share with us some of the problems or blockages that the fallopian tubes can experience?
Okay, so we are talking about actually 1/4 of the people they suffer from infertility actually have some problem with their tubes. Because the tubes are blocked, so you can imagine that the eggs and also the sperm don't have a chance actually to meet and to fertilize to form a babies. And some of the common causes of the tubal blockage, including endometriosis, or some people would call it chocolate cysts. Some people may have heard about it. And then the other risk factor for having a tubal blockage would be having a history of pelvic infections before, or any abdominal or any pelvic surgery, even like surgery for appendicitis. And there may be some scarrings or some adhesions forming after the surgeries, which block the tubes.
Yeah, with endometriosis, what are some of the symptoms for some of our listeners listening? It's extremely painful when some people experience extreme pain when they have their period. What other symptoms are associated with that?
Yeah, so that's true that pain is actually one of the most common symptoms for endometriosis. People will experience pain during the menstruations. They sometimes have pain even during defecations or going to the toilets as well. And we do have
so serious.
Yes, we do have women, they even have pain during sex. But then one of the problem with endometriosis and pain is actually the symptoms, the pain symptoms and the severity, it doesn't correlate. So we do have women have no pain at all, but they have got very severe disease and a very blocked tube. But we have got women with severe pain, but at the end of the day, they only have very, very mild disease.
Yeah, and I've heard, I've known people before. I remember I went to school with a young lady who turned out to have endometriosis, but really, for just 2 weeks a month, she was having very heavy period and very severe back pain. Yeah. And so then later on in life, in her 30s, then she was diagnosed. But a lot of the times, people don't know what they're experiencing until much later on in life.
Yes, because that is also one of the issues of endometriosis is actually have a very long delayed diagnosis. Some studies do say that the delay of diagnosis can up to 8 to 12 years as well. So that is one of the things that we suggest couples or women actually, if they do have any issues or any worries in terms of like having severe menstrual cramp or if they have difficulty having a baby, then they should actually go for a checkup early rather than to wait until really the problems really get very worse or at the very, very late stage.
Yeah, so you mentioned also scarring can also block the fallopian tubes.
Yes.
Are there ways we can prevent these blockages?
Unfortunately, we didn't have very good ways to prevent it. Because sometimes the surgeries, it may be essential, like for appendicitis, we really can't avoid it. And some pelvic infections, it can be quite unavoidable. Of course, we are talking about having safe sex using condoms. It can prevent the chance of having a sexually transmitted illnesses. And
STIs can also cause
a tubal blockage. But then for endometriosis, there's nothing we can prevent it actually, because even talking about the causes of endometriosis, we don't have a clear idea from our medical point of view as well.
Yeah. Can you tell when your fallopian tubes are blocked? Are there any symptoms? Do people experience pain, or how can people get diagnosed?
So most of the time, the problem is people feel nothing at all, because some people may have some very mild cramps, but it is usually not to the extent that they will go to see a doctor.
Yeah.
Yes. Only most of the time they will come to see us when they have problems having a babies. So yeah, with fertility, when they try for up to a year and without any news at all, then they will come to see a doctor. But then for some women, if they have got risk factor, we are talking about if they really have history of pelvic infection before, or have any history of any tummy surgeries before, then we advise them actually to come for a checkup early on, because just based on the symptoms, we can't really diagnose a tubal blockage until we go for some very specific tests.
Yeah, well, you mentioned some pretty shocking statistic that 25%
Yes.
of people who try to have babies or infertility is because of these blocked tubes.
Yes.
So there are a pair of fallopian tubes. If one side is blocked, is it likely the other? Will it affect the function of the other side? How does it work?
So most of the time the problem is if because when we're talking about looking back at the causes of the tubal blockage, and most of the time it just causes blockage of both tubes. Like, for example, history of surgery, history of infection, endometriosis. It is not a selective. Yeah, it's not a selective disease that affects on one tube. And that's the reason why most of the women, they at the end of the day have both tubes being blocked or being diseased as well.
Yeah. So what happens if you only have one fallopian tube? How might that affect your chances of getting pregnant?
So we are talking about if you only have one tube, then your chance of having a baby actually reduced by 20 to 30%. Wow. And although it is not up to 50, because some people will think I've got two. One is blocked, one is normal, then probably my chances is reduced by half. But from statistic, we know it is only reduced by 20 to 30%, because we do have some data suggesting that actually the eggs can go through the other normal tube in order to get fertilized and become babies as well.
Oh, yeah, that was my next question. So the eggs know to move to the working fallopian tube rather than the blocked one.
Yeah.
Oh, clever.
Because actually what we do know is actually the ending of the tube, they will secrete some chemicals which can attract the eggs to go through the tube. So only normal tubes will secrete that kind of chemicals. And that is one of the hypotheses that we are suggesting why the chance of having a baby only reduced by 20 to 30, but not by 50%, even after having one tube removed or one tube being blocked.
So what happens when people have blocked tubes? Are there procedures where they can unblock these tubes? And how successful is the unblocking of the tubes?
Yeah, so talking about unblocking the tubes, usually women need to go for a surgery. We are talking about a keyhole surgeries, with several, one holes in the belly buttons and 2 to 3 smaller holes in the lower part of your tummy. And we put in some instrument. What we are going to do is actually to make a new opening at the tube in order to make the tube patent again. Oh, okay. But then the problem with that is, firstly, it involves surgeries. We need to put you under general anesthesia. We need to put you under sleep. The general risk of any surgeries like infection, bleeding, or the risks that applied as well. And then the other thing is that we do worry is sometimes we are talking about the surgery itself may not be successful, because for a severely damaged tube, even after we make another new openings, the tube may still not be patent, especially for those with very severe disease with multiple adhesion sites. And then the other thing is we are talking about your chance of having a baby even after the surgeries of making a hole in the tubes is in 1 year only 20%. And when talking about for 2 years is around 25%. And so for the surgery to make an opening of the tube, we only usually apply it to very selective cases. We are talking about those women, what we call with good prognostic factors, like, for example, they have got more mild disease, and those younger women, because we all know that like fertility is
chance to
closely related to age. Like if we're talking about a woman over 40 years old, we don't think it is reasonable for them actually to try to have the surgery and to try to conceive naturally for another year before going through
IVF,
other ways to have a baby.
Wow, Dr. Lui, it's such an emotional topic because, how do women and partners, men as well, handle that sort of prognosis when they, when there's so little that they can do, when the prognosis aren't good, that even by unblocking, the chances of getting pregnant is quite low. Yeah. What about fallopian tubes? Can they have multiple blockages? So the same tube with multiple blockages, and then can you unblock them with one surgery in one go?
So we are talking about some of the tubes, they really can have multiple blockages. And so in that cases, usually what we actually recommend is to go for IVF directly if we are talking about having a baby. Because a blocked tube is not like other diseases, like for example, if you have got a cyst, if you've got a polyp, then you need to go for surgery actually to remove it. But then for a blocked tube, it actually don't affect your hormonal functions, it don't affect your menstruation. The only thing that it affects is having a baby. So for women, if they only have blocked tubes, but they didn't have any fertility wishes, then they can just leave it alone. Okay. Just forget about it.
So there are no other sort of diseases involved, associated with a blocked tube?
Yes, especially for those women, they didn't have any symptoms at all. But then if you were talking about having a baby, if you have got severe disease or multiple adhesions, then we know that the chance of unblocking it is quite high. So for example, like if you have got a scar, if we need to revise the scar, we need to do another surgery, but another surgery may even cause more scar. And so that is the issues of going for surgeries if we have got multiple adhesions and multiple blockage. And in that group of women, then sometimes we will advise them actually to go for IVF directly rather than to go through the surgery to try to unblock the tube. And at the end of the day, we didn't have a good result. But when we compare about the chance of having a baby with IVF, if tubal factor we are talking about is the sole factor for infertility, then she do have a very, very good chance of having a baby with IVF.
Yeah, with the clients you see, with the people you see, do a lot of them, the causes of infertility, is a lot of them linked to fallopian tube health?
Yeah. Yes.
Yeah. And how do you go about diagnosing? Is it through an ultrasound that you can see right away, or do you need an X-ray? How does it work? Okay,
so we are talking about maybe 1/3 to 1/4 of the patients actually have a collection of fluid inside the tube. We call it hydrosalpinx. If they do develop hydrosalpinx, then we can see it on an ultrasound scan. Just a very simple pelvic ultrasound scan. We can see it. But then, however, if the blockage is not that severe to have a collection of fluid inside the tubes, then we need to go for more sophisticated tests in order to go for it. So one of the commonest, like the first line test we go for is called HSG, hysterosalpingogram in the long form. So HSG, what we are going to do is we inject some dye into the womb, and then we take multiple X-ray to see whether the dye actually go through the tubes to the abdomen.
And if it doesn't, then that means you have the blockages.
Then we know the tube is being blocked. But then the problem with going for the HSG is, firstly, it involves taking multiple X-rays. So it may involve a very small dose of radiations. And then it can be slightly painful procedure because sometimes the dye itself is a little bit irritative. And then it involves a small chance of infection as well. So the other newer technology that we can go for is actually called hypophy. So for hypophy, it is slightly different. So we inject, this time it's not some dye, it's some foam, into the womb, and the form can actually be visualized on ultrasound scan. So the woman then no need to go for any X-ray in order to check the tubes.
Oh, wow.
And also with the form itself, it is less irritative than the dye. And what we know is it was less painful, as has been like described by other women. It's less painful, or sometimes being not painful at all. And then we are talking about the correlation or the accuracy. It is very, very similar to the HSG or even going for the surgery. And of course, the gold standard for checking for the tube is we go for a surgery. With a keyhole surgery, then we can have a direct visualization of the tubes.
Oh, wow. I can't imagine injecting foam, though, in the body. It just sounds so much thicker than dye. Dye seems a little bit less viscous, but foam just seems...
Yeah, just foam. Yes.
Yeah. Dr. Lui, before I let you go, what about for women who are at the end of their fertility journey? We've often heard of people getting their tubes tied.
Yep.
Is that the fallopian tubes that they're referring to?
Yes, that's the fallopian tube they're referring to.
And how invasive is that procedure? How easy is that procedure? And I mean, is it easy to recover from such procedure?
That is actually a very easy procedure as well. We are talking about a quick keyhole surgery. It can be a day surgery. It only lasts for, the surgery itself, it takes less than 1 hour most of the time. Oh. And the risk itself is quite minimal as well. So although it do involve general anesthesia and all the general surgery risks, but the good thing about it's a one-off procedure. So you don't need to worry about having contraception afterwards with a very, very good successful rate. But nowadays, we do have other options. We have got very good coil. We have got some hormonal coils as well. We give us a very similar success rate, talking about in terms of contraception. And the woman no need to go for surgery. And
less invasive.
Yes, less invasive, and also reversible as well. Because for tubal surgery, it is sort of a irreversible surgery. But if you have a coil, if you wish to have a baby, maybe a few years later, then we can just remove it. Yes.
Is it totally irreversible? Can you untie the tubes, or is that an even more sort of difficult surgery?
We can untie the tube and to reconnect it. But then it involves a even more complicated surgeries, and we even need to sometimes use a microscope in order to look at the tubes to do all the microsurgery, we call it.
Exactly. Wow. So
because the tube itself is actually very tiny. We are talking about the lumen of the tube itself is only 1 to 2 millimeter.
Wow, that's thinner than the hair.
Yeah, we're talking about the lumen itself. Yes, it is of that size. Wow. So that's why we would say it is sort of a irreversible one, because even we can go for the surgery to reconnect it. We would expect, the function is not as good as before. Yeah.
Wow, Dr. Lui, I learned so much from you this afternoon. I'm sure our listeners did as well. You can revisit this interview on our Facebook page, Noreen Mayer on RTHK Radio 3. Meanwhile, many thanks once again for your time this afternoon. And we've been speaking to Dr. Ellen Lui, who's a specialist in obstetrics and gynecology. Thank you so much for your time this afternoon.
Thank you.